Empathy is seeing with eyes of another, listening with ears of another, and feeling with the heart of another. To learn the art of understanding someone's state of mind is very important for us as medical students. I welcome you all on this platform. There are some case scenarios with me today. I will put forward one to each one of you. Please share how you could connect with the patient and what emotions may be revolving in the patient's or his or her family's mind. Okay, let's start with Samhita. So, Samhita, your case is an old lady who is lonely and she has been diagnosed with hypertension. What will she feel?
So the first thing that I would take into consideration in this case is that she's probably living alone and she doesn't have those many visitors or relatives. So I would let her know that I'm only a phone call away. And if she has any questions or requires any assistance, I'll always be there to help her. Second, I would understand that having a medical condition and going through it alone is a very mentally challenging task. So I would assure her that I'm here if she wants to, share her fears or if she feels anxious or stressed out. And I would make sure to check up on her at least every once a week or 2 times a week. As an elderly woman, transportation must be an issue for her. So I could go to her house and visit her whenever I can and make sure that she's doing okay. And lastly, I would give her a little bit of hope by giving her tips on how you can reduce the risks of hypertension, like take less salt in your food, exercise, and eat healthy food and stuff, so that she has some sort of hope that she will be all right. So that's how I would view the situation.
That was a very useful piece of advice, Samita, and you did show your care very nicely towards the lady. Okay, let's move on. Next, we have Harshita, and Harshita, your case is parents are bringing a child with cerebral palsy. Cerebral palsy is basically the child has some mental disability and he may also suffer with certain degrees of physical disability. The child is aging, but on his mental state is still the same or is younger to his age. So, what is your take on how the parents or the child feels?
Thank you, Bhavna. I would like to explain a little bit more about cerebral palsy because we're not very used to its name or what it consists of. So, cerebral palsy is basically the disease of the brain, which causes paralysis. So, there is loss of coordination, there's loss of movement, and you cannot do activities that require precision. And these are not activities that are like really hard to do. These are very simple activities that we do without even thinking in our day-to-day lives, like walking, talking, eating, or doing anything else, basic things. Now, the neurological conditions are always very serious, but this one is actually even worse because it happens to your child, and like the child has not even started his life yet. It's a treatable disease, but it's not curable, and its causes are not very well known. Now, I would like to talk about the emotional stresses that the parents will go through, the struggles they'll go through. First off, it can be found prenatally or postnatally. Both of those scenarios I'll explain. So, the first one could be that the mother could be going to the doctor for her daily checkups, as pregnant women go to during pregnancy, and she might find out then. Or it could be that she could have delivered the baby, and then all of a sudden her baby would be taken to the NICU. Both of these cases are shocking because, like, one of the best days of their lives get converted into one of the worst. Not just that, the future of the child's life is also at stake because they might worry about the child's independence. If the child if the child has to spend the rest of his life on a wheelchair or not, then they might worry about his schooling because The effects of this condition are very visible. So he might have to face bullying. They might worry about his job and the pressures that society will put on him. Apart from that, I mean, on top of that, there are also medical expenses to bear, which are quite high because it requires a combination of therapies. The first one being you have to consult a neurologist, then physical therapies to improve movement, speech therapies to improve speech. Then they also need to be able to afford a live-in nurse to take care of the child 24/7. But even after all these struggles, after a few years, they're able to adjust to this lifestyle. They start appreciating the small things, simple things like going to the bathroom, eating, swallowing. They don't take things for granted anymore, and they start working. Anyone who's suffering from a big struggle or a big problem, they start supporting that cause. They care for it, and they start charity. They start doing donations, and they seek ways to help others who are facing from the same problem. So that's great. That's it. Thank you.
That was very well explained, Harshita. I can see you have understood cerebral palsy and related emotional stresses very well. Okay, next we have Dikshita with us. And Dikshita, your case is a woman is rushed to the labor room for delivery. Family is both excited and nervous. What is your take on this?
First of all, hello everyone. The whole process of giving a birth to a baby is simply amazing and superb. So the woman goes through a roller coaster of emotions in this whole 9 months. She'll have so many of mood swings, and she'll have this sense of responsibility of being a mother, and she needs to inculcate so many qualities that a mother should have to to raise a baby. And at that moment, uh, the baby in her room is going to see the world for the first time. We can't even describe how a father feels when he holds his baby for the first time and closer to the heart. How does a mother feel when she holds her baby for the first time? She has so many thoughts in her mind. She's too anxious, tensed, and so excited to basically see the baby, which she was carrying for the past 9 months. And it would be a precious moment for the whole family to see the baby which is coming into the new family. And it would be, for the doctor, it should be very important to support the people, to support the women. And it would be mentally very challenging to give birth to the baby, right? So what she needs is all support. And as as a girl, we should also be everyone know that like it's very difficult to go through all the process. So what she needs is more support and help and a love. That's it. Thank you.
Wow, Dikshita, that was beautifully explained, and we all had the smiles on our face. We could imagine how the baby is taking birth. Very nice. Okay, next we have Prerna with us. So, Prerna, your case scenario is parents bring their son to emergency who has tried to commit suicide. Brought on a stretcher, the boy is presenting with excessive frothing. What is your take on this?
So first of all, there is a case of emergency, and there is immediate action required. So first of all, we have to deal with the clinical symptoms. The boy is facing chemical chemical symptoms. The chemical is injuring his body inside. So first we have to deal with that because that's an emergency, and we have to deal with that. And after that, because it's a suicide, and the parents are seriously worried because suicide is not something you can have symptoms of it before it has occurred to the person. Suicide is something that is very sudden, and nobody is ready for that. So of course the parents were not aware of his child, that something is going in his mind which is disturbing him to such an extent that he has taken the step. So there is a very much tension and hyperness in the uh, in the patient's parents' mind. So we have to deal with that also. First, just to stabilize the patient, giving him the proper medication he needs, and then talk with the patient's parents also, because we have to deal with them. We can't take that I am a doctor and my responsibility just lies to patient, and I have no responsibility to deal with them, because you have to tell them that the patient is progressing, he has some symptoms, so situation is like this. You have to tell them so that they would remain calm, so that other processes would be easy for the doctor and all the staff to go on. Because if the parents are not calm and they are not knowing about their son's situation, it would create an havoc at the hospital side, because we see that parents or other family members can start fighting with doctors. So we have to concern with that thing. And after that, it's a suicide case. So something is there in the mind of the boy that has triggered this action. So we have to deal with that, because in a country like ours, when we are so much concerned about our daily bread, so the psychological problems with which the persons like youngsters like us, we have also gone through depression and other things throughout our studies, and we still go on. But these things are generally get unaddressed because we don't have time. So we have to deal with that. We should ask for the patient that if he is feeling something inside his mind that is disturbing him, well, we should talk with parents that there is someone in the family whom is very close to the patient, so that he can come here or can talk to the patient, so that the ultimate cause of the suicide, the such an extreme step will come out, and we can deal with that. Because we can save the patient for once, but if the reason for the suicide has not been corrected, the reason is not addressed, it will happen again, and that would be very devastating, and that would have very devastating effects. It could result in ultimate death. And I also believe that as a youngster, that suicide attempts and all the things related to psychological problems need very important addressal and need our immediate action and immediate response. So the response should be in listening. We don't have to tell him that everything happening in his life that is disturbing him is all part of life. We have to listen him that his situations and his problems are something which is, yes, everyone faces, but they need some addressal. We can't say that everyone faces this is a phase, it will get over, just don't mind it. We don't have to do that. We have to listen him what is causing his problems. That's the thing. Because in our world we are so busy, we don't listen. So we have to give him empathy, imagine ourselves in his situation, and imagine our needs, that what we want as emotional support. We want to express ourselves, we need someone who can listen us. And second is filling the part. You fills the part that he needs. You will be the listener, become the listener. And the third thing is sitting in silence. You have to be silent. You know that we can't have any specific solution for such problems. We can't have definitive solutions to such kind of problems, but you have to listen him. Oh, so these are the things which I believe in such problems have to be done for a better improved world. Thank you.
Thank you, Prerna. You really emphasized on the need to listen to the patient and address his problems at a wider level. And thank you for taking us through the psychological stress that can come in this situation. Next, we move on to Harita. And Harita, for you, the scenario is there is a patient who is looking for an oxygen filling station, which was quite common in today's world. So, what is your expression on this?
Yes. Firstly, good afternoon, everyone. Hope everyone is safe at your homes.
Well, coming to the question, as everyone of us know better that nowadays in these times of pandemic, to what extent, I mean, increasing extent, the oxygen has been supplied and used. So obviously, the patient who is in search of oxygen supply will put himself or herself in a situation of trepidation. So firstly, I will go and I will put the patient in a calm situation. And firstly, I will advise him or her to check up their saturation, I mean, oxygen saturation. If it's below 94, then only I will suggest them to go for, I mean, to get the access of oxygen, because for above that, like for 95 or 98, doctors are advising not to go for oxygen supply. So firstly, I will advise to check up the oxygen levels, and then I will let them know the areas which have the access to oxygen supply, and then I will advise them also to buy a oximeter to time check up their oxygen levels. And the third most important thing is I will suggest them to lie down in a prone position, and I will also explain them the importance of lying down in a prone position, because it helps in the expansion of the dorsal thoracic region, and also it enhances the oxygenation, that is the breathing. So yes, I will do these things. Thank you.
Thank you, Harita, for explaining how to manage such a situation where the patient is in need for critical care. Okay, next we move on to Fagun. So, Fagun, your case is a child is born to a woman, but the child has Down syndrome. How will the woman or the family will be feeling?
So yes, I will now describe the state of mind of this woman, this mother, who has given birth to a child with Down syndrome. So in this situation, of course, she will be shocked at first. Then she'll face denial, and then she'll be in disbelief of the situation. She'll be angered. She might even be depressed. And she might ask herself these questions: that why is this happening to my child? Did I do something wrong? Maybe it's my fault. So there's a lot of guilt. There's a lot of self blame in this. So she might think that maybe I could have done something better in this phase of pregnancy. Maybe I could have protected my child from this fate. So yeah, these will be her feelings. She might be feeling all this. And then there's a lot of uncertainty in the situation, uncertain about what the future holds. Will this child of mine ever be able to live a normal life? Will I ever have a normal family life to look forward to? And with this uncertainty comes a lot of questions. She will have a lot of questions for sure, and she might need answers, comforting answers even. And also, she might be looking for. Um, there'll be a lot of expectations. She will expect that the best possible services be provided to this child, and the best possible education be provided. She might obviously always she might be very optimistic about this. She might even believe in miracles, or maybe even not even in results that are not that realistic, to be honest. So this is the state of mind of this woman, right? And we need to understand that this mother is now going to raise a child of special needs. So we need to show a lot of compassion and a lot of support to this woman. And we need to know that we cannot rush these feelings. We cannot rush through these phases. We cannot say that she needs to get over it and get started on building a life for this new child. So yes, that's going to be it. Thank you.
Thank you, Fagun, for connecting us to the mother who is concerned about the future of a child. Now we have Roshni with us, and Roshni, your case will be caring for a patient on dialysis. How will the patient and family be feeling?
Well, Bhavna, the patient who are undergoing dialysis, they must adhere to a very strict diet plan, restricting food intake, fluid intake, decreased ability to travel. These all gonna show effect on their mental health. Sometimes they may feel very low, that they could not lead their lives like others. In that case, we will be motivating them, and we should provide moral support. During procedure, you should be very careful, very careful. You should be very careful. Continuous monitoring vitals are very important. Sometimes they undergo hypoglycemic condition, sudden BP drop, uh, edema. You should be responsible of what you are doing, and you should motivate. You should always create a positive vibe around the patient, that he could recover fast. As we all know that patient attitude directly correlate with the recovery. So make them feel comfortable to express what they're feeling, and explaining them risk factors, and what are the complications, or what care should be taken, and how to communicate with them. It's make different sense to them. Yes, Bhavna. Thank
Thank you,
you.
Roshni, for explaining us the need to pay attention to the patient's state and making them comfortable when they approach us. Okay, we have Shobna with us, and Shobna, your case scenario is parents are welcoming a child who has just recovered from acute meningitis. I would like to tell that the child was earlier bedbound. He was in coma and was having fever and vomiting, but now has completely recovered. How will be the family feeling?
And thank you so much for this opportunity, first of all. Then I congratulate because of the continuous efforts of the physician, parents, and of course patient beat this disease and recovered successfully. The disease affect the individual not physically but also mentally, psychosocially. In every aspect, it affect a lot. The patient see no colors in his life, and ever changing behavior make him more diseased, and the patient become so negative and sees no chances of recovery. But here physician and the parents play very important role. Parents must be strong and always be positive, give motivation to their child, have food together and some recreation activities, that he will always be inspired and be happy, and said them that he would surely recover definitely and beat this disease. And then the role of physician come. The physician collect more detailed medical and psychosocial information. He did more accurate diagnosis and treatment, and most important, prolonged communication with the patient, understanding each and everything, its attitude, its behavior, psychology make that difference. And after recovery, now the patient feels like he had faced the most difficult phase of his life and fought the disease strongly. Now it's a beginning of new life which is full of opportunities and new aspects of the life for him. He is thankful to his parents and a lot more faithful towards the physician who treat him, and most importantly thankful to God. He also feels so much confident from the parents counterpart, as they are happy as their son recovered completely and their worriedness dissolves. There are a lot of emotions varies this illness behavior to the happiness after the recovery. Happens with not only the patient but also with the parent. That's all. Thank you.
Thank you, Shobna, for allowing us to feel the happiness that the family is currently feeling, and also emphasizing on maintaining the communication with the patient even after the recovery is done. So we have Divya with us now, and your case for today, Divya, is family is celebrating successful renal transplant of grandfather. So what will be the feeling like?
Thank you, Bhavna, for giving me this topic because the same happened with my grandfather. So I hope I able to explain this well. that during that time, what me and my family feels. Actually, before the news that my grandfather done, that doctors done uh, the the successful renal transplant, the family members, we all are very sad and worried and tensed so much that now what is going to happen next. But as doctor and the hospital staff gave us the news that the renal transplant is successfully done, my family members are very happy and relaxed, especially we children, because we have a close attachment with our grandfather. My grandmother is like very happy. She before that she is very stressed and thinking about that what is going happen to next, and so much negativity in her mind. The in that time the hospital staff played a very important role. The nurse, every time she came to my grandmother and telling her that there is no need to worry. If you feel like, if you create a negativity in your mind, it will be like in you damage yourselves also, and also your husband also feel negative. So don't be, there is no need to be panic. So as she get this news, she is like very happy and relaxed and kidding with my grandfather that now no one can stop us to celebrate our anniversary that is coming in next days. So, and also my father giving thanks to doctors and the hospital staff for that for this great job of doing successful renal transplant that gives our family a very happy and relaxed state. And also he supports the hospital staffs and encourage them that they keep my grandfather in a positive state of mind, that he have not to worry about his illness. He have to only thinking the joy after his recovery, the family members, and he will feed. That's it. Thank you so much.
Thank you, Divya, for sharing a part of your own experience and motivating all of us to work for someone's happiness. Because when recovery comes, not only we feel happy, but the patient and the world which he is carrying feels happy. So, thank you all for expressing freely with all of us today. I hope we all got a chance to be in someone else's shoes and could feel what they feel. To conclude, in William Osler's words, the good physician treats the disease, but the great physician treats the patient who has the disease. So may each one of us learn to listen the other with empathy. Thank you.
Thank you so much, Bhavna.
Thank you.
Thank you, Bhavna.
Thank you, Bhavna.
Thank you. Thank you.